Hello everyone. So today we are going to talk about control of typhoid disease. So we have three parameters, either the control of reservoir, control of sanitation level and immunization. So let's proceed with control of reservoir. So starting with the control of a case. So first thing we need to do is we need to diagnose a case early, that is by serological investigations or other immunological investigations. The next thing is we need to notify the disease if the disease is exotic for some area. Another thing in the case is that we need to isolate the patient for at least until there are three negative bacteriological reports of stool and urine culture. Plus, these three reports should be taken on 3 different days. Now, in treatment of typhoid, nowadays we use the first line drug as fluoroquinolone. Now, rarely when the cases of typhoid are multi-drug resistance, we go for azithromycin or ceftriaxone. There are multiple other options available also. Now, if the patient is in a serious condition and he is toxic, we also give the steroid hydrocortisone daily, that is about 100 mg for 3 to 4 days. And disinfection of stool and urine is done by 5% of cresol for 2 hours. And we need to consider this, that we have to follow up the case by culturing the stool and urine at 3 to 4 months, and again we follow up the patient on 12th month, that is yearly, because we want to prevent the carrier state. So this is how a case of uh, typhoid is controlled. Talking about the carrier, as Park has stated, it is the crux of controlling our problem, typhoid disease, because these are the one which will freely go here to there and spread the disease, because they are asymptomatic and they are harboring the bacteria within them. So this is the most radical way of control of the typhoid disease. Now, identification is the most important part, and this is also done by serological examinations. And 80% of chronic carrier, so VI polysaccharide antibody positive. So this is important, that 80% of chronic carriers have VI polysaccharide capsule antibody positive. Now, carriers are treated by giving a concentrated ampicillin or amoxicillin 4 to 6 gram per day for around 6 weeks, and this has been found to be 70% effective. Now, more effective than this is, as we know, the carriers harbor the bacteria within the biliary tract and the gallbladder. Cholecystectomy plus ampicillin therapy is found to be 80% effective and is the most effective for carrier state. Another thing we can do is we can surveillance for the carrier. uh, okay, and the last thing is, and another very important point is the health education, educating the people for hand washing prior to their food, and following the um use of toilets. So the crack, we must remember that carrier is what is the most radical way of control. Now going on to the second point of controlling the sanitation level, this is in conjunction with the health education. So we need to give the people health education, plus we need to improve the domestic drinking water supply, plus food hygiene is must. The third level at which we control the typhoid is immunization. Now, immunization is not 100% effective, but it do decreases the incidence and seriousness of the disease if it occurs. Now, who do receive these immunization? They have to be more than 2 years. The most of the people residing in endemic area should receive it. They or the household contacts of a typhoid patient, a traveler to an endemic zone, or people going to yatras or melas. So we have two vaccines here. We have one vaccine that is a polysaccharide vaccine, that is the VI capsular polysaccharide. Okay, and another one is the typho oral, that is a oral vaccine, that is a live attenuated vaccine. So, talking about the first vaccine, that is VI polysaccharide vaccine. So, here we need to remember that it is a T cell independent IgG response. Since it is T cell independent, if you increase further doses, there is going to be no benefit of giving more than one dose. So, here the important point is we have to give just one dose of this vaccine, and that is to be given either subcutaneous or intramuscularly, and it is to be stored at 2 to 8 degrees Celsius. Okay. We have to have revaccinations every 3 years to maintain the level of antibodies. The vaccine is effective 7 days after the injection, and this vaccine can be co-administered with other vaccines like yellow fever vaccine or hepatitis A vaccine, and can be included in immunization schedule. Now, this vaccine does not have any contraindication and no major side effect except for hypersensitivity found. And in patients of HIV, it has no side effects, but the effect of this vaccine on HIV patients depend on the CD4 count of that HIV patient. Now, talking about the typhoid oral vaccine, that is a live attenuated vaccine, so it is enteric coated and has to be given in an age more than 5 years. Now, this is given in 3 doses with a gap of 1 day in between, that is on the first day, third day, and fifth day, and it is to be repeated every 3 years. But it has to be repeated every 1 year in traveler, which are more prone for the infection. We also need to remember that this oral vaccine, its action can be affected if we give proguanil or other antibiotics 3 days prior to this vaccine or 3 days following this vaccine. So these proguanil and antibacterials are contraindicated for plus minus 3 days following the vaccine. So these are the things we need to remember about control of typhoid disease. Hope you like it. Thanks for watching.